Hey, it's Dr. Birchler. As a chiropractor, you might imagine see a lot of people with various complaints of pain, stiffness, aching, things like that in the body. And sometimes the question comes up of, whether that's purely a mechanical pain, pressure, tension, compression, things like that, or whether there's some kind of biochemical factor, inflammation, unresolved inflammation, and things as well. And both of those things are very common. And so for a person to get the best results, we want to look at both of those things. Sometimes there's clearly one thing more predominant than the other. What I want to discuss with you here is being able to assess whether you actually have kind of excess inflammation or things, or could benefit from doing an anti-inflammatory supplement protocol, certainly diet changes and things as well. Most people have heard of omega-3 or fish oil. So that's a type of fat, healthy fat, that ultimately comes from basically from grass and algae, and then animals eat that, and then other things eat the animals, and then you actually get that in the body from the diet. And a lack of that proper healthy type of fat, or eating too much things that are grain, too many things that don't have that type of fat, can create this imbalance and lead to what generally people call inflammation and that kind of thing. So some signs of deficiency of that healthy type of fat, joint pain and stiffness. I deal with that stuff all day. The knees, the ankles, the shoulders, the elbows, the wrists, all kinds of stuff there. So when a person has a lot of aches and pains, and it doesn't seem to be purely just a mechanical or injury or thing, that's something we want to look at is would they be healthier, would they feel better, would it help them if they were to get this kind of biochemical and inflammatory omega-3 deficiency thing improved. And in many cases it does. This chart here is just a simple list of some symptoms that can be associated with deficiency of omega-3. So certainly there are other manifestations in health and cardiovascular and skin and all kinds of things, but let's just use that as an example here. Now, those healthy fats are involved in what you might think of as resolving inflammation. So this green says inflammation resolving. So our body needs to produce inflammation. Some people think inflammation is bad. It is not. That is the body's response to injury, to trauma. We have to have inflammation, and when there's something that's injured, that is the way the body responds to repair it, and that's a good thing. But for that to turn off, I want you to think of a switch, like a light switch. If it's on, and then when you want it off, there's a switch to turn it off. So in the body, that switch to turn off inflammation, it actually has to physically have a certain molecule, and that molecule comes from these fats, this omega-3. So when you have trauma, when you have problems, and that's life, we have these things, if you don't have the biochemical there that allows it to be turned off, you end up with these kind of chronic pain, stiffness, inflammatory kind of things. It's like the body doesn't have a switch to turn it off, and it's not a physical switch, it's a chemical switch from these nutrients. So supplementing and or changing the diet, of course, can be things where you're now able to get that resolved and feel much better and be much healthier. Now the question is that actually happening, and there's a way to know whether that's happening. There is a test. This is the one I recommend here. It's a finger prick blood test where you can send that into the lab, and then they can evaluate the ratio of inflammatory to inflammation resolving fats, these omega-3 to omega-6 ratios and things like that. This is just a sample report from the company of when they actually do that test, and they'll show you what they call the omega-3 index from kind of good to very bad. They'll show you the ratio of the the omega-3s, or these inflammation resolving type of healthy fats, to the ones that we have too much of in our diet commonly. The omega-6, which contains what's called arachidonic acid. So it'll show you where you're at in the levels, and if the levels are in the red areas here, for sure you have confirmation that that level isn't good in your body. And so the flip side of that is when you get that corrected, you'll probably feel way better, in addition to being healthier and mitigating other types of diseases associated with a life of chronic imbalance in these nutrients. Now, as another related thing to this is the anti-inflammatory drugs like aspirin and whatnot. They as a drug, work in the same pathways that these nutrients work. However, the drugs are terrible. They're kind of blocking normal function of the body. They may relieve symptoms, but it's not actually healthy because they're not supplying the body what it needs, and so you'll have these other issues, and that's not a good way to deal with it. But what I'm getting at here is if you take those kind of medications and the pain changes, you have another layer of confirmation that okay, there's something to this inflammation thing. So if you actually got what your body needed nutritionally, biochemically, don't take any of that other nonsense, but get what your body needs to just do that from the inside out, healthy nutritionally. If those medications change it, you'll likely get a very good response in terms of feel better, less pain when you actually supplement with omega-3 fats and get this whole thing in balance there. Okay, so this test called the omega-3 test from this company, Omega Quant, that's the one we recommend. We can do that here in the office, but then you're able to actually get yourself some data to say where you're at, would you benefit from doing that, and then possibly retest down the road after several months to see if the levels are better. Most people could benefit from just supplementing with omega-3 their entire life, but for somebody who wants to get some data on that, possibly decide when they could reduce their the amount of supplementation a little bit, the test could be redone. But we found this helpful, and when you get this corrected in the body, if it's off, flat out, you're going to feel better. You're going to notice that your quality of life is going to be better. And so in addition to taking great physical care of the body and identifying real mechanical, physical, and neurological problems, which is our area of expertise, this is something that if it's missed, you can go on a wild goose chase of all different kind of stuff, and it wasn't the right thing in the first place. And at the very least, when you're dealing with other things that are real, physical problems, mechanical problems, when you get this kind of biochemical stuff under control, even if there's some of that other stuff going on, you're going to get better results when you kind of look at it from both those angles. If you have questions on this, you let us know, but this is what we recommend to do to identify that and have the first step towards getting that corrected.